Gastrointestinal system drugs. GI tract, mouth, pharynx, esophagus, cardiac sphincter, stomach, pyloric sphincter, duodenum, jejunum, ileum, ascending, transverse, descending, sigmoid, rectum. Peptic ulcer disease, PUD, acid irritates lining of the stomach or small intestine. Stomach produces mucus, small intestine produces bicarb. This protects the lining from acid. 85% of cases of PUD are due to H. pylori irritates epithelial cells and is toxic. Lining becomes less able to protect itself. If irritation is severe enough, bleeding occurs, manifested as blood and vomit, or as coffee ground appearance. Anti-ulcer drugs. Used to eradicate H. pylori or restore balance between acid and pepsin secretions in GI mucosa. Patient teaching elevate HOB, don't lie down 1 to 2 hours after eating, decrease intake of fat, chocolate, citrus, coffee, and alcohol, avoid smoking, take medications with water to avoid stomach irritation, exercise regularly.
Systemic antibiotics. H. pylori is a Gram-VE bacteria. Eradicate bacteria equals promote ulcer healing and decrease recurrence. Usually combined with proton pump inhibitor or H2 antagonist. Side effects: mild GI disturbance, abnormal taste, diarrhea. Antacids. Used for PUD and GERD. Alkalines, calcium, magnesium, aluminum, sodium carbonates, and hydroxides that neutralize pH of stomach. MOA, neutralize acid in GI tract. Allows peptic ulcers time to heal. Pepsin, digestive enzyme, acts more effectively when acidity in stomach is higher. By reducing acidity, pepsin is reduced. Side effects: constipation, diarrhea, bloating, electrolyte imbalance, aluminum accumulation. H2 receptor antagonist. Used for PUD and GERD. In stomach, histamine binds to H2 receptors on parietal cells, stimulates acid secretion. MOA, blocks H2 receptors, prevents stimulation for acid secretion. Side effects: headaches, decreased liver function, loss of vitamin B12 absorption.
Stool softeners. Used for constipation. Surfactant lowers stool surface tension. Water moves more easily into stool. Stool is easier to pass. Side effects: diarrhea, throat irritation, cramps. Stimulant laxatives. Used for constipation. Irritates bowel. Promotes peristalsis plus secretion of water into bowel. Movement of feces increases and softens. Rapid effect, used as prep prior to surgery. Side effects: weakness, cramps, mild inflammation of rectum. Osmotic laxatives. Used for constipation. Osmotically draws water into bowel. Risk of dehydration. Side effects: weakness, fatigue, distension, electrolyte imbalance, dehydration. Antiemetic and anti-nausea drugs. Ondansetron, Zofran, is the medication of choice. Antihistamines block H1 receptor. Prevents SCH from binding to receptor. Phenothiazines block dopaminergic receptors in chemoreceptor trigger zone, normally stimulates vomiting. Serotonin receptor antagonist blocks serotonin stimulation in chemoreceptor trigger zone and in vagal nerve terminals. Both of these normally stimulate vomiting. Side effects: antihistamines, drowsiness. Phenothiazines plus serotonin receptor antagonists, confusion, anxiety, agitation, depression, headache, restlessness, weakness. Anticholinergic effects of antiemetics, constipation, dry mouth, urine retention. Genitourinary drugs. GU system, reproductive system plus urinary system, kidneys, ureters, bladder, urethra. Kidneys, dispose of waste in the form of urine, filter blood, maintain fluid, electrolyte balance, produce hormones plus enzymes, convert vitamin D to a more active form, and help regulate blood pressure plus volume by secreting renin. Diuretics. Thiazides, hydrochlorothiazide. Used for edema, diabetes insipidus. Reduce reabsorption by inhibiting NO+, Cl, cotransporter in the ascending loop of Henle = prevent reabsorption of NO in kidneys = increased excretion of NO, and thus water. There is also an increase in excretion. Side effects: hypokalemia, hypoglycemia, hypolipidemia, hyponatremia, hypercalcemia, low blood pressure, orthostatic hypotension. Decreases responsiveness to oral hypoglycemics.
Loop diuretics. Used for hypercalcemia, hyperkalemia, pulmonary edema. Inhibits reabsorption in ascending loop of Henle = increases excretion. Very rapid effect. Side effects: hyperglycemia, electrolyte imbalance, hypokalemia, hypovolemia, hypotension, ototoxic. Potassium-sparing diuretics. Inhibition of aldosterone by canrenone = increases Na+ excretion, decreases K+ secretion and excretion = Na+ excretion promotes water excretion. Side effects: hyperkalemia. Contraindication: hyperkalemia, renal insufficiency. Urinary tract antispasmodics. These drugs help decrease urinary tract muscle spasms. Used for overactive bladder, urge incontinence, neurogenic bladder. Drug inhibits PNS = relieves smooth muscle spasm by relaxing detrusor and urinary muscles. Side effects: blurred vision, headache, urinary retention, dry mouth, weight gain, glaucoma. Monitor voids and assess for overactive bladder, urgency, incontinence, and frequency. If co-administered with strong CYP3A4 inhibitors, drugs should be given at reduced dosage.
Erectile dysfunction drugs, phosphodiesterase 5 enzyme inhibitors. Erectile dysfunction = due to lack of blood flowing through corpus cavernosum. Drug selectively inhibits phosphodiesterase type 5 receptors = causes increase in nitric oxide = activation of cGMP enzyme = relaxation of smooth muscle = increased blood flow to corpus cavernosum = erection. Side effects: sildenafil = hypertension, cerebrovascular hemorrhage, headache, dizziness, flushing, dyspepsia, vision change. Drug is to be taken 30 minutes to 4 hours before sexual activity. If the erection lasts more than hours, medical intervention is needed. Do not take erectile dysfunction drugs if also on nitrates or blockers for HTN or angina. These drugs have no effect without the presence of sexual stimulation.
Pregnancy drugs. Oxytocics. Used to promote uterine contraction. Activates G protein-coupled receptors that trigger increases in intracellular calcium levels in uterine myofibrils = stimulates uterine smooth muscle = promotes uterine contractions. Also has vasopressor and antidiuretic effects. Oxytocin is contraindicated for contractions closer than 2 minutes apart. Monitor patients. Tocolytics. Used to block uterine contractions.
Hormonal contraceptive drugs. These drugs inhibit ovulation. Suppresses gonadotropins = inhibits ovulation. Estrogen = suppresses follicle-stimulating hormone = blocks follicular development plus ovulation. Progestin = suppresses secretion of luteinizing hormone = prevents ovulation even if follicle develops. Progestin = thickens cervical mucus = interferes with sperm migration plus implantation of fertilized egg. Side effects: arterial thrombosis, thrombophlebitis, gallbladder disease, acne, bleeding between periods, bloating, breast tenderness, change in libido, weight fluctuation. Oral contraceptive. Taken for 21 of 28 days with 7 days of placebos. If patient misses 1 day, double up on the next day. 2. Non-oral contraceptive. IM injections of medroxyprogesterone, Depo-Provera, = 3 months of contraception. No plant system, celastic capsules containing levonorgestrel that are implanted into skin = up to 5 years of contraception. Transdermal patch, Othivra = change patch once a week for 3 weeks, then no patch. NuvaRing, vaginal ring changed once per cycle.
Hematology drugs. Hematology system = plasma, liquid component of blood, and blood cells. Hematinic drugs. Aid in red blood cell production, which then also increases hemoglobin increases oxygen transportation. Used for microcytic and macrocytic anemia. Iron. Treats the most common form of anemia iron deficiency anemia. Most important role of iron production of hemoglobin by increased erythropoiesis, production of red blood cells. Pregnant patients should take iron due to fetus using up the iron. Iron absorption is reduced by spinach, whole grains, coffee, tea, eggs, and milk products. Side effects: gastric irritation, constipation, dark stool. Vitamin B12. Used to treat pernicious anemia. B12 is necessary for cell growth plus replication and for maintenance of myelin in nervous system. OHCl acid and intrinsic factor from the parietal cells of gastric mucosa are necessary for absorption of vitamin B12. Pernicious anemia = decreased gastric production of HCl acid plus deficiency of intrinsic factor. Side effects of parenteral B12: itching, rash, hives, hypokalemia, polycythemia vera, heart failure, pulmonary edema, anaphylaxis. Assess patient for vitamin B12 deficiency, pallor, neuropathy, psychosis, red plus inflamed tongue.
Folic acid. Used to treat megaloblastic anemia caused by folic acid deficiency. Usually occurs in pediatric, pregnant, elderly, or alcoholic patients. Folic acid is necessary in RBC production plus growth. Large doses of folic acid can counteract effects of anticonvulsants. Side effects: erythema, itching, rash, anorexia, difficulty concentrating, irritability. Epoetin alpha. Erythropoietin forms in kidneys when there is hypoxia plus anemia. It stimulates erythropoiesis in bone marrow, RBC production. These drugs are given to PTS with decreased erythropoietin production. Side effects: HTN is most common, headache, edema, fatigue, dizziness, chest pain, skin reaction. Anticoagulant drugs. These drugs reduce the ability of the blood to clot. Assess for SS of bleeding or hemorrhage, bleeding gums, nosebleed, bruising, black tarry stools, hematuria 1. Heparin and heparin derivatives. Used to prevent clot formation. Does not dissolve already formed clots. MOA. Drug activates antithrombin 3 prevents formation of thrombin plus fibrin. Thrombin time and PTT are prolonged in patient taking heparin. Low molecular weight heparin used for DVT prevention. Side effects: few side effects. Bleeding, bruising, hematoma. PTT is maintained at 1.5 to 2 times the normal. Antidote for heparin is protamine sulfate. Oral anticoagulants. Main drug in this category warfarin. Rapid absorption, but effects are not seen for 36 to 48 hours. MOA inhibits vitamin K dependent activation of clotting factors. Side effects: minor bleeding, bruising, hematoma. The effects of warfarin can be reversed with vitamin K. Monitor INR. Antiplatelets. Used to prevent arterial thromboembolism, used in patients at risk for MI, stroke, and arteriosclerosis. Absorbed quickly plus reaches peak in 1 to 2 hours. MOA. Drug blocks synthesis of prostaglandin prevents formation of platelet aggregating substance, thromboxane A2. Side effects: bleeding is most common side effect. Others include stomach pain and heartburn. Contraindicated in active bleeding. Thrombolytic drugs. These drugs dissolve existing clots. MOA. Drug converts plasminogen to plasmin dissolves thrombi plus fibrinogen. These drugs are most effective when given within 6 hours of onset of symptoms. Side effects: bleeding. Contraindicated in active bleed. Maintain bleeding precautions during administration.